81,000 cases of vaginal discharge syndrome compared to around 80,000 in the previous year. So those are the numbers of reported cases of vaginal discharge syndrome. But we find that based on a study which we conducted, etiological study that we conducted recently, we realized that about half of these vaginal discharge syndrome cases, there were no pathogens, there were no agents that we identified. Then we realized that another 20%, 1 out of 5 women, had the candida infection that I spoke about. And then the other 50% had the real pathogens that cause sexually transmitted infections. So now speaking about these urethral discharge syndromes, so I'm going to speak about each of these different syndromes because there are some differences in terms of statistics. The urethral discharge syndrome in men we received reports of about 65,000 cases in 2019. So there was a slight increase of about 10,000 cases from the previous year. And this is an indication that we still have high-risk sexual practices that need to be addressed. And this could be likely due to some shortages of condoms that we experienced in 2018 and 2019. And even this year, we've had challenges in terms of distribution of condoms because of the lockdown measures due to COVID. So, but we have sort of resuscitated, and we hope that there will be improvement in terms of supplies and distribution of condoms. So in terms of, so for both urethral and vaginal discharges recorded in 2018 and 2019, the age band that recorded the highest figures for both of these syndromes was the 25 to 49 year age band, 25 to 49 years. And in terms of where these cases were coming from, most of these cases were coming from Midlands province and Mashonaland West provinces, those two provinces. So moving on to genital ulcer disease. Genital ulcer disease, this is an important syndrome in the sense that when there's an ulcer, where there's a break in the skin within the genital area, the risk of acquiring HIV is higher. So these are the conditions that increase the risk of individuals acquiring HIV. So we noted that there was a reduction of genital ulcer disease cases from 35,000 in 2016 to 32,000 cases in 2019. Most of these were reported among the 25 to 49 year age group, and more males than females. So for genital ulcers, it's more males that are affected than females. Midlands province had contributed the majority of genital ulcer disease, followed by Mashonaland West province.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.